I'm Michelle Brown, an assistant professor in clinical laboratory science in the School of Health Professions with a large passion for interprofessional education and transfusion medicine.
Immediate spin is positive. At what temperature is immediate spin?
We use simulation a lot to teach teamwork and how we all work together for the betterment of the patient. And we all have to work together as a team. And if we don't work together as a team, what happens? And a simulation is a great place to do that. We use the simulation arena to create a safe learning space so they can implement what they've learned from the classroom and can use it within an interprofessional team in an environment where nobody's really going to get hurt. So they can practice what they've learned, see the outcomes, communicate with each other, and just watch the whole process. During an interprofessional simulation, they're able to balance specimens on various patients from different parts of the hospital, work on different areas of the laboratory, and they learn a lot about prioritizing specimens and which comes first and how to communicate with a sense of urgency or how to communicate when there's a concern. So we see them start at the beginning of the semester as kind of timid, kind of task-focused, and then through simulation we get to see where they've grown into being able to balance, being able to problem solve, being able to communicate effectively with other members of the healthcare team. Well, on an academic level, it's been something we've been able to share with the rest of the laboratory community, that we've been able to get laboratory involved in interprofessional simulation that's really novel. We just did a presentation at our educators conference and had a very large audience that was really excited to see how we were able to get the lab involved. Traditionally it's kind of medicine, nursing, respiratory, and really to increase the fidelity of the simulation, we've been able to incorporate the laboratory. From a student perspective, they're able to get their first clinical conversations out of the way in a safe container like we were talking about. And so that when they're out there in practice, they've already learned how to communicate a critical result or a specimen error or a concern while they were a student, and when they're a professional they can feel confident about their ability to communicate.